Welcome to the module, Working with the Healthcare Community. This is the third of 10 presentations in the course, Healthcare Transition Training for Educators. One of the basic goals of this training program is to provide information that facilitates a partnership between educators and healthcare providers. By the end of this module, you will be able to partner with healthcare providers on behalf of specific students and on behalf of the broader population of youth with special healthcare needs in your school, coordinate care during healthcare transition, and discuss healthcare transition with families and students. The first section will describe differences between healthcare and education, as well as commonalities between the two communities. Before continuing with this section, consider the differences in approach between educational and medical interventions. Take a look at how each field defines and identifies students with additional needs. What differences and similarities do you notice? In the medical community, care coordination involves determining where to send the patient next, what patient information to send with referrals, and how to manage accountability among all providers. Healthcare professionals notice failures in coordination, particularly when the patient has a poor health outcome after falling through the cracks. That might mean directing the patient to the wrong door, a poor handoff, or inadequate information exchanges. In schools, service coordination involves promoting seamless delivery among multiple agencies, using similar goals and tasks as healthcare coordinators. Educators also notice failures in coordination when students experience a poor outcome after falling through the cracks. In both worlds, successful transition is predicated on effective care or service coordination. Infusing healthcare transition-related activities into the school setting through IHPs, IEPs, and 504 plans has several advantages for students. Skills used in healthcare transition are similar to those in the Special Education Transition Plan. Healthcare professionals understand that children develop at different rates and have different kinds of skills. They want to help children to acquire new skills over time. Schools are a practical, comfortable, natural learning environment where a number of different individuals may be available to support the adolescent. Partnering with providers during healthcare transition leads to stronger results rather than duplicated efforts in your shared activities. The following section provides a brief review of the ways in which healthcare needs and medical treatments may affect learning. Recall from Module 2 that youth with special healthcare needs are defined as children who have or are at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. They have a wide range of conditions, from allergies to diabetes to muscular dystrophy to intellectual disabilities. Nearly 20% of children in the U.S. are youth with special healthcare needs. Compare the definition of youth with special healthcare needs and the categorical areas for special education services. Clearly, there is overlap, as nearly 1/3 of youth with special healthcare needs also receive special education. Unfortunately, the majority do not have educational services in place. Data from the National Survey of Children's Health indicate that in Florida, about 39% of youth with special healthcare needs receive special education, while the majority do not. Conversely, those students who do not meet the definition of youth with special healthcare needs are also unlikely to receive special education. What can we learn from this? These data suggest that healthcare providers and educators come to the same conclusions when they assess students who do not require extra assistance. However, many students struggle with chronic health conditions and meet the definition of youth with special healthcare needs, yet are not identified for special education services. Let's see how health conditions affect their learning. Nearly half of youth with special healthcare needs missed 5 or more school days due to their illness. If we focus only on youth with special healthcare needs who missed the most school days, then we see that 48% of the students experienced multiple functional limitations. More than 1/4 of youth with special healthcare needs in Florida have repeated at least one grade, which is greater than the national rate. In contrast, 12% of youth without special healthcare needs in Florida have repeated at least one grade. Thus, youth with special healthcare needs in Florida are more than twice as likely to repeat a grade than students without a special healthcare need. In summary, data clearly show that, while the term child with special healthcare needs is not one that is used in the school systems, they are an academically high-risk population. About 1/3 of the children who receive special education services in Florida appear to meet the definition of youth with special healthcare needs. When they are at school, youth with special healthcare needs may have difficulty with attention, concentration, and endurance because of their condition or their medical treatments. Thus, from an educational perspective, it may be useful to think about youth with special healthcare needs as students who have diverse learning needs. Anyone who has had a brush with the medical system knows that it can be quite challenging to understand a diagnosis, communicate with doctors, make medical decisions, follow a treatment regimen, and deal with insurance. People with chronic conditions and disabilities must develop healthcare competencies to meet the challenges of the day. Remember, skill development is a step-by-step process that involves planning and follow-up. It is best for students to receive gradually increasing levels of responsibility over time while they have support from family, school, and child-focused providers. The healthcare community recognizes that educators are key partners in the effort to provide youth with the services they need to transition successfully to all aspects of adulthood. Educators already serve as the linchpin in the larger transition to adulthood and in skill development. There is no other institution or profession that does more to prepare youth with special healthcare needs to achieve their greatest level of individual independence. The schools also have the lead responsibility in addressing school-to-work issues and supporting the move to post-secondary education or training. America relies on you to teach students essential skills, such as reading for comprehension, basic math, communication, critical thinking, planning, and decision-making. Without such a foundation, medical providers cannot expect youth to play a progressively active role in their own health care. Child-focused healthcare professionals are encouraged to inform their patients about the need to prepare for changes in healthcare, but are not required to do so. In contrast, schools are legally obligated to include transition goals in IEPs and to create a plan for addressing these goals. When we say that providers are encouraged to address transition, we mean that their professional organizations, the American Academy of Pediatrics, the American College of Physicians, and the American Academy of Family Physicians have released joint policy statements, clinical guidelines, ethical practices, licensure provisions, and evidence-based tools to steer providers toward delivering excellent care during healthcare transition. The consensus statement also discusses why planning for the move to adult care is so important. It identifies critical first steps that ensure that their patients successfully transition to adult-oriented health care. Childhood-focused providers are responsible for tasks that prepare your students for a successful transition prior to the care transfer. Adult-oriented providers are responsible for tasks that maintain continuous, coordinated care after the transfer is complete. The following section discusses the evidence for healthcare transition practices and provides data on how the healthcare community is doing without your help. The National Child Health Survey of all families in the U.S. asked parents if medical providers helped adolescents prepare for the healthcare transition. Survey results showed that this outcome was achieved for only 41% of adolescents in the U.S. Data from Florida indicate only 37% of adolescents received key healthcare transition-related services. In rural areas, it dropped to only 20% of youth. It is important to understand that while the Healthcare Transition Consensus Statement reflects important clinical guidelines, these recommended activities are not yet included in any federal legislation. Compare that to schools, where IDEA regulations define and mandate transition services. Educators are students' only source for clearly identified and guaranteed transition preparation. Let's face it, reaching out to a new group of professionals may be a challenge. In the next few slides, we'll identify potential barriers. Barriers for partnering with healthcare providers as an educator may center on the barriers everyone encounters when adjusting routine tasks at work. Medical providers, educators, students, and their caregivers all will be concerned about uncertainty in this, as well as existing time constraints. Including a new group of providers may also raise concerns about role clarity within the special education team. While these barriers arise from natural concerns, partnering with the healthcare community will actually address more barriers than it raises. What would you want a pediatrician to know about a student's IEP or 504 plan? What could the participation of a nurse or physician's assistant add to your student's transition plans? What barriers to a student's successful transition could a medical provider help prevent or address? Write down your responses to these questions. The slide will advance in 60 seconds. Now that we've reviewed potential barriers, let's discuss resources and strategies that address them. When holding plan meetings with students and their families, include providers beyond the initial evaluation. You might start by identifying a natural partner, such as the student's CMS plan nurse, the pediatrician office's care coordinator, or a social worker at the specialist's office. Try contacting the person who sends you the special education evaluation documents. Provide them with a copy of the student's transition goals. CMS Plan Nurse Coordinators receive special training in healthcare transition, provide program enrollees and their families with transition materials, and develop a healthcare transition plan with all enrollees. CMS Plan staff often have a long-term working relationship with the student and family. They also have more frequent contact with the student's primary and specialty care providers. For students in the CMS Plan program, including their nurse coordinator in the school's transition planning process is a natural bridge between you and the healthcare community. Find out if your students' healthcare providers have broached the topic of healthcare transition. If not, spend time educating them about the issues that need to be addressed and identify useful healthcare transition resources. If yes, the provider may be eager to support the school-based transition plan and to partner with you. Either way, encourage families to work directly with their healthcare providers to identify healthcare transition priorities and develop a plan to address these priorities. Incorporate these healthcare transition goals and activities into school-based transition plans. Use your existing resources and models to frame discussions with parents on healthcare transition within the framework they already understand. Before closing this module, we will review resources for use in your school. CMS Plan has 15 area offices and additional locations throughout the state of Florida. CMS Plan program staff receive training in the federal and state rules and regulations for both healthcare and education, such as FERPA and HIPAA. They are interested and available to partner with educators to support students with disabilities and chronic health conditions. The CMS Plan serves children with special healthcare needs who are enrolled in the program. Enrollees must meet financial and clinical eligibility requirements. Children may be found clinically eligible in one of two ways: based on the responses to a parent-based survey which determines if the student is a youth with special health care needs, or based on their doctor's confirmation of diagnosis and functional limitations. The National Center for Transition has many tools to partner with care coordinators and other healthcare providers during transition. The Florida Transition Task Force report entitled Ensuring Successful Transition from Pediatric to Adult Healthcare is available on the Florida Health and Transition Services website. It provides detailed information on healthcare transition needs across the state. Florida Hats offers a complimentary version of this training course for healthcare providers. As you go through this training, remember the differences in transition between the healthcare community and educators. Keep in mind that healthcare transition is essential to the success of your existing transition services. Healthcare providers are a natural source of partnership in your efforts. Use the links from this course's toolkit to access the tools from this module. The next module covers important health insurance information that affects many aspects of the transition to adulthood. You can pause here for a break or continue on to the next module.